everyone. My name is Danielle Gatti Palumbo. I'm a clinical pharmacist, and I'm also a RhAPP Board member as well as a faculty member. And today I'm joined by Monica Richey, who is an esteemed RhAPP faculty member, an educator, a mentor, a colleague, and also a friend. And today we have something truly special. We have a live episode, a live podcast right here at our RhAPP National Conference in Nashville, Tennessee. So it's been really, really fun and really fascinating. We have a great patient case to highlight for our RhAPPcast right now. And full disclosure, me and Monica work together. She is, I know, right? She is my work wife, my work sister, I would say. And really highlighting our APP interdisciplinary relationship as Monica being the nurse practitioner, so she treats the patients, me being the pharmacist, so I'm more of the drug expert. So she'll come to me for often a lot of drug info questions, a lot of lookups on side effects. And I have this problem. I gave the patient the kitchen sink and I don't know what to give them next. So looking up journal clubs and contacting MSLs to find if there's any like off-label use for medications. So Monica particularly called me about 3 weeks ago prior to this conference and said, I have another patient case and there's a little oopsie. So we'll go into that. And she's like, what do I do? And how do I dose this medication? And I was like, you know what? We really want to increase our education for conventional DMARDs with our RhAPP cast and also our RhAPP content. So I said, you know what, Monica, let's discuss this as a podcast series on our RhAPPcast because I think a lot of people will actually have the same situation that you actually ran into. And it's a really common scenario that comes up. So let's go into that case.
So just to clarify, we not just work together. She sits next to me for a child. So I bother her a lot. Right?
A lot.
She is my go-to number one person. And this was an interesting case because this is a patient with Sjögren's. And later she developed lupus, who was on Plaquenil for about a year and developed severe skin disease from the Plaquenil. It almost looked shy. She developed scleroderma-like. So we had to completely stop the Plaquenil. And at some point she got a dose of rituximab, but she continued to have some joint pain. I think she was at the time when she started Leflunomide, she was 37, 38. So we talked about, pregnancy. She's like, no, I'm not married. It's not a problem. So she's been on Leflunomide now for 3 years, doing very well, I may say. Control her joint pain really good. Her skin started to get better after we took her off of the Plaquenil. And then I would say about 2 weeks ago, she sent me a message that she was pregnant. And I lost my mind completely. I'm like, what do you mean you're pregnant? At this point, she's 41. And apparently she remarried and, resume her sex life and wasn't planning, didn't even think she could get pregnant and got pregnant while taking Leflunomide. I mean, she's been on Leflunomide for 3 years and she was about 8 weeks pregnant when she called me.
Wow.
So, I didn't know if I congratulated the patient, if I jump out of the window, what am I going to do? 8 weeks is very late at that particular point in time. So I panicked. And obviously I called Danielle.
And obviously when she calls me, I'm like, what do you mean the person's pregnant? I was like, what do you mean? Like, why did you put this person that was possibly going to become pregnant on Leflunomide? And she's like, this was not.
That's why she told me. Right.
So I'm like, oh, hell. The first thing that we basically talked about was like, okay, well, we have the cholestyramine. That's the only option, right? So, or activated charcoal, but she's 8 weeks pregnant, so I don't think you really need the activated charcoal, but that's more for drastic measures. But the cholestyramine, going over the dosing, it was 4 grams every 6 hours for 2 weeks. Or
11 days.
Yep. Yeah. Or 8 grams 3 times a day for 11 days. And with this medication, which is also something, we don't come up with these scenarios so often. So we don't, teach patients about them like on a daily basis. But this medication is actually not even a pill. So it's important to make sure that you teach your patients that it actually comes in like a packet that you have to mix with 2 to 6 ounces of a liquid or so. You can mix it with applesauce or crushed pineapple or even soup. But it's also important that they wash it down because I didn't know this until like after I looked into it, but it actually can cause discoloration of your teeth. And if it remains on your teeth, it can actually decrease your, actually break up your enamel on your teeth. So if you're taking this for 2 weeks, I mean, it can definitely do some damage and cause some sensitivity and also a lot of constipation. So you want to make sure that they drink a lot of water or any kind of liquid. And it also can cause some bleeding. So they may get like a nosebleed or so. But that dissipates after discontinuation. So, but that was some interesting.
Yeah, and you also need to be sure that the patient is taking. So I kept an eye on her, I kept messaging, how you doing with the medication? You tolerating well, because sometimes people can have diarrhea from that. She told me she was taking it. She finished 11 days and I sent for a level. It's not completely at 0.
Oh, so
I
we
had
have to
restart it on
So are you going to repeat that
cholestyramine.
whole,
Gonna repeat it. I'm gonna
whole
keep repeating
course,
until it's
2-week
completely
course,
out of
right?
her system.
Right.
Yeah, she saw MFM, and she's scheduling for a ultrasound to make sure there's no malformations on the baby. So she hasn't decided if she's keeping until MFM tell her it's all clear.
And probably genetic testing and stuff. Yeah.
Right. So that is all pending, right? So that, I have to say, was my first pregnancy case on Leflunomide. In particular, at that age, like 8 weeks, when she called me, I had a panic attack, I have to say. I have lupus patients getting pregnant all the time, mycophenolate, I'm a pro dose. But Leflunomide is a really scary kind of drug that I really only use it as a last resort. Like everything failed. Can't tolerate methotrexate, can't tolerate Plaquenil,
Right.
And she did super well.
Yeah.
So that was the scary Leflunomide story that I have. Usually patients just complain, my hair's falling or something like that.
Yeah.
And it was also my first skin disease from Plaquenil. I mean, it was extensive. I mean, the skin became harder over the arms, on the face. She had black marks all over her torso and her abdomen. It was extensive. She really had a terrible reaction to the hydroxychloroquine.
Did you ever think of sulfasalazine? Because that's also safer in pregnancy as well, too.
Well,
right?
I mean, she wasn't planning to get pregnant, girl. What am I going to do? It was like,
I mean, and the fact that it lasts in your system for 2 years, you can't really, you should be planning that, but
she didn't even tell me that she got pregnant. She got married.
And you think she would call you a little earlier than 8 weeks, right?
Right. But apparently she didn't think, she thought she was actually, because of her age, she was menopausal.
Yeah.
So she's like, oh, maybe I'm just menopausal, right?
And
so she waited.
So the missed period was really a menopause,
8 weeks,
right?
like, let me do a pregnancy test. She said she literally did 3 pregnancy tests. And then she asked, because she works for a doctor's office, that they did a blood sample and it was still positive.
Oh, gosh.
So that's when she called me.
Yeah.
Right. What did she, and when she saw that I panicked, she's like, what is wrong? And I'm like, remember when we talked about this? So she's like, oh, yeah.
Have you ever had any other cases with like other conventional DMARDs that you kind of had these oopsie situations that are difficult?
I mean, methotrexate once or twice, but it was early in the pregnancy where you stop it, and you pray also for the best. As I say, mycophenolate has been my standard. Lots of lupus patients get pregnant.
But in your methotrexate, you get the leucovorin?
Yeah, make sure the levels are 0. And that is much faster to come out of her system. I mean, Leflunomide, in a way, even when you stop, is in your system for a year.
Right.
So clearance of that drug is mandatory for the safety of the baby.
Mm-hmm.
So, yeah, no, that was my first whoopsie with Leflunomide.
And then going forward, has this changed the way that you may have spoken to patients, and especially if they're in their 40s, when you may not think about them getting pregnant anymore, or they're, in different relationships?
I honestly thought about making them sign a contract.
Really?
With blood in it.
Yeah. Please do not get pregnant while on any of these.
Not get pregnant ever. Talk to me before having sexual relations. But, I guess now I'm going to have to be a lot more strict. I mean, as I said, I don't usually prescribe for young people ever.
Yeah, but you already threw the kitchen
for
sink,
menopause,
right?
But for her, it had been a difficult situation. But yeah, definitely not ever prescribing to a 38-year-old that swears to you is not planning any pregnancies.
So now going forward, now that she is pregnant, what are you going to give her instead?
Absolutely nothing. I cannot give her Plaquenil. So prednisone is going to be my way to go if she needs rescue. As I said, she has this Sjögren's, goes back and forth. Her serology changes at times pretty strange case. But most of her symptoms were joint pain. So, she has no lung disease. She has no other thing that makes me think that I need to, upgrade the treatment because she was doing so good. Her numbers were stable. She was happy. I guess very happy. And, but yeah, so as I said, I usually, don't do that for a young woman ever. From now on, I guess I'm going to have to, get a written contract. I would not get pregnancy. But yeah, it's interesting because we work with DMARDs so much, right? And both in this particular case, both the Plaquenil and the Leflunomide, caught me by surprise.
They're basically our backbone, our tic-tacs of
Yeah,
rheumatology.
I mean, not much Leflunomide. And,
I know. Well, some providers actually will start Leflunomide before first line as opposed to methotrexate. Mm-hmm. So sometimes it is provider preference.
Yeah.
I know we have one provider in our practice that does that. And then we have other providers that if you're female and you're, not even menopausal, will never even give methotrexate or Leflunomide.
No, and I pick up patients from the community that came on Leflunomide and methotrexate, and my hair just end up. I'm like, no, unless you have a liver, blood work every week, we're not doing this combination, right. I even asked one of our physicians, like, well, every once in a while, very severe cases, we tend to use that. But I got a couple of, I think a doctor in the community retired and started getting a lot of them were in the combination of Leflunomide and methotrexate.
Right, yeah.
And they would be seeing, like, no, he sees me every 6 months.
Yep.
And oh my God,
I know that's another common thing that I'm like, I don't know if I really feel comfortable with that, but it has been done and it's done safely in some patients. And as long as the provider's okay with it and they're comfortable with prescribing that, then, as long as you're monitoring the patient, it should be okay.
Very closely.
Right, very closely.
Yeah, no,
exactly.
for sure. But as you said, DMARDs are our backbones.
I know.
And even though very well that I tend to push for biologics.
I know you
first
do.
line.
I know you do.
Forget methotrexate, forget everything.
I know you do.
In some cases,
you drive me nuts sometimes trying to get her biologics approved. I will say that.
Yeah, I get that call. What are you thinking?
Why? You're driving me nuts. But that's the glory of insurance companies.
Yeah, but that's the glory of having a Danielle Gatti working with you.
Yes.
You can get them.
You're spoiled. By having a pharmacist.
I am terribly spoiled.
Hopefully maybe one day every practice will have a pharmacist.
You can only leave when I retire, so
you're not retiring, so anyways. You have more stamina than me. But so thank you for joining us and for discussing these patient cases. I know we're at the national conference, so what has been your favorite part of this national conference?
Well, first is seeing everybody here. I mean, it's an amazing
a great reunion,
turnout.
Right?
I was in one of the first meetings and there was like 40 people and now we're at like 400, 500. That's amazing, bringing all this community together.
This is actually one of our largest attendings.
Yeah. No, it's amazing to see, and people coming back every year, bringing friends, that's
and you were here from the beginning as well. So it's great to see.
I see it grow and always it's great happiness to me. I've been to the masterclass session, which was amazing.
Oh yeah, that was great.
That was a great session.
That was a good feedback we even got, and it was actually really nice to see like the physicians, working together with their APPs and the relationship that you saw there. And it's just like a down to earth kind of respectful,
very
working
they have amazing relationships.
Yeah. All right. Well, that brings us to an end to today's episode. We hope you enjoyed this live session from RhAPP National Conference here in Nashville, Tennessee. I hope we brought some valuable insights to you all for patient cases and difficult to treat patient cases and some oopsies that you may or may not encounter, but eventually you probably encounter at least one of them in your career. And thank you for sharing your expertise and walking us through your patient case. To our listeners, whether you're at the conference or here listening or at home listening or online listening, I hope that you take the time and join us next time for RhAPPcast. We're here to connect to the latest information on rheumatology practices. We're always excited to bring great content to both educational and also practical use. So don't forget to subscribe to us, like us on social media, and visit our content room, which has all of our greatest and newest educational sessions. And I'm excited to bring you some more. Thank you.